Stevens-Johnson syndrome can be very beneficial if recognized early on, as well as knowing the causes and treatments of the disease for those who are at risk. During my senior year in high school, my mother became extremely ill. We noticed patches of fresh burns that appeared on her skin. Shortly after, she began taking a few new medicines. We immediately rushed her to the hospital where she was diagnosed with Stevens-Johnson syndrome, the topic of my speech today. Stevens-Johnson syndrome is important because recognizing symptoms early on is crucial because the disease can turn very deadly in a matter of hours. My credibility is established by having not one but two close relatives to experience the disease. My key ideas throughout this speech include the symptoms, the causes, and the treatments of the disease. Initially, knowing causes of the disease can reduce the risk altogether. The most common cause of the disease is an allergic reaction to medicine. By an allergic reaction to medicine, I mean that taking antibiotics followed by, but not limited to, common medicines such as pain pills or common cold medicine. There is also another cause called genetic predisposition, which means that an abnormal variation in the human leukocyte antigen complex, or the white blood cells within your body, can increase your odds for contracting the disease. Other common viruses and illnesses such as herpes, pneumonia, and hepatitis A can increase your risk of getting the disease as well. Second, recognizing early onset symptoms can be the difference between life and death for someone with Stevens-Johnson syndrome. First, flu symptoms may begin to appear. Then the flu symptoms are usually followed by a painful rash that spreads in blisters. In some cases, patients even begin to shed the top layer of their skin. More specifically, in my mom's case, she shedded the first and second layers of skin. The most common symptom is skin appearing to have fresh burns without the skin actually being burned. Finally, treatment of the disease is only available by a medical professional, which makes it a lot more difficult to become treated. It can be the equivalent of those of second and third degree burn victims, which may include burn wraps and burn pain medicine. Another type of treatment is given through fluid and electrolytes. The fluid and electrolytes are used to pass medicine through the system quickly and decrease the allergic reaction. This is the most common form of the treatment. In conclusion, Stevens-Johnson syndrome can be a very deadly disease. The earlier disease is treated, the better the outcome. Having knowledge of the causes, symptoms, and treatments of SJS is vital in recognizing it early on. I hope the information you were provided with today gives you insight on the severity of Stevens-Johnson syndrome. I hope you use what you've learned today to one day be able to recognize Stevens-Johnson syndrome early on and maybe save a life. The aftermath of Stevens-Johnson syndrome can include loss of senses, loss of appendages, organ function, and even